Next, this is Dr. Shinya. Now it says world-renowned MD, and the first time I saw this, I didn't know who Dr. Shinya was. Okay, he's world-renowned because of his invention. In 1969, Dr. Shinya invented the procedure called colonoscopy. Okay, and if you haven't met it, just be patient. You might get to meet it one day. Okay, so Dr. Shinya has been using our Kangen water with over 300,000 of his patients. Okay, that's called a clue, by the way. Somebody who invented the colonoscopy prescribes our Kangen water, not just alkaline water, Kangen water, made by Magic, okay? Big difference. So out of those 300,000 patients, Dr. Shinya has not had one reoccurrence of any kind of cancer or degenerative disease, okay? He does change the diet a little bit, but one of the things he does is he puts all of his patients on the Kangen water right after their first colonoscopy. So I'm going to show you some really great pictures. These are some before and after pictures of some of his patients here. Okay, so look at the before, look at the after, and you pick which one you would like to have inside your body, because we all have a colon, okay? So the before picture is obviously sick, and the after picture, to me, looks pretty healthy. That's probably the one I would want inside of me. Next one I have is a 45-year-old female with breast cancer and chronic constipation. And I apologize, I know that these are graphic, but I'm just here to make you guys a little more aware of what's happening inside of you, okay? And look at the after on this one. And this is just 90 days after treatment, again, changing the diet a little bit and changing the water, okay? And you don't have to take my word for this. I've done a lot of studying over the last year. I've read all of these books on here, and you can do your own research. Pretty much everything that you'll find supports the fact that acid equals sickness and alkaline equals health, okay? So one of the things I like to point out here is, it says, you're not sick, you're thirsty. Don't treat thirst with medication. And here in America, I mean, we're pretty much a pill for every ill kind of a society. My head hurts, where's the Tylenol? You know, my stomach hurts, it's burning, where's my Pepto-Bismol? You know, I mean, we have a pill for everything. But we never think, well, I wonder why I got that headache. You know, maybe I'm dehydrated. I mean, these are some simple things to start asking yourself. So once you start changing the water inside of your body, you'll be amazed at what starts happening. Another thing that happens, it says without enough water, your body goes acidic, goes into fat storage. So imagine this body becoming so over-acidic, and what is it going to do with all this acid? There's nothing that you're doing to neutralize it. Well, what it does is it stores it in fat tissue, and it places it wherever you like to store fat. Some people it's in their stomach, some women their butt and thighs, wherever it can, right? And I tell people, don't get mad at the fat, it's saving your life, okay? You're not really overweight, you're over-acidic. So that's why we have a lot of weight loss stories. Once you start flushing out the acid, the fat leaves with it, okay? So that was pretty exciting for a lot of my clients. And of course, everybody has their own story. Once you start drinking this water, again, if you can start by taking your body weight, dividing it in two, that's a good amount of ounces to start with every day, okay? I know some people don't even drink that much in a week, but that's a problem, okay? Because again, we're made of water. So if you can get up to 1 ounce per pound every day, that's when you're really going to start seeing some results and the miracles. And it's not the water that's the miracle, it's your body. Okay, your body can heal itself once it's in homeostasis. Okay, so try the water, drink enough of it, and you got to stop the sodas and the sports drinks, okay? And you'll definitely start seeing some results.